Dear audience, let me introduce my PhD topic, which is control of fear memories and the management of dental anxiety. I'm Ábel, a fifth-year dental student and the first-year DMD PhD student. And my vision is less anxious patients in the dental office, and to achieve this, my mission is to provide data for policymakers to create guidelines. I have two projects for this year. The first one is investigating the efficacy and safety of pharmacological interventions on anxiety in patients undergoing dental treatment. Please look at these pictures. How do you feel about them? For most of us, these are everyday work instruments, but for some of our patients, these can be the subject of the fear. If you look at this diagram, it clearly shows that the reason of fear from dentists mainly arises from injection and pain. If this fear becomes so severe, we can call it a condition, which is dental fear and anxiety, which is associated with unrealistic negative emotions. Its prevalence is around 15%, affecting 150 million people in Europe and in the US together. If a patient has dental fear and anxiety, this means they visit us less often or not at all, which can lead to untreated dental conditions, which also affect their systemic health. So we have to do something with this. We have pharmacological interventions, and we have also behavioral and psychological interventions. Let's focus on the pharmacological interventions. We have benzodiazepines, which are effective and potent drugs, but they also have notable side effects and addiction potential. We also have herbal extracts, namely valeriana and passiflora, which can be effective as well. So in this project, our aim is to find effective and safe management methods for dental fear and anxiety. The clinical question is, what is the most effective yet safest intervention in reducing dental fear and anxiety? We would like to investigate patients undergoing dental treatment with pharmacological interventions compared to placebo, and our outcomes are anxiety scores and physiological state anxiety measured by blood pressure or heart rate. We also would like to investigate side effects and safety listed in this slide. So our hypothesis is that benzodiazepines and herbal preparations can effectively reduce dental fear and anxiety, and the latter have better safety profile. So the clinical implications for this is if we can reduce dental fear and anxiety, we can have more visits from these patients, they will have better cooperation, so we can provide them better dental care, their satisfaction can increase, and also we could decrease the complications. We did the preliminary research and found the previous meta-analysis and systematic review, but there's also room for improvement. We can include new articles, focus on herbal preparations, and investigate the safety profile, which is missing from this previous study. Here you can see my 3 key articles regarding the herbal preparations, all comparing to placebo and measuring anxiety. So we designed the search key with 2 domains. The first one is targeting dental fear and anxiety. The second one is about pharmacological interventions. We did the Prospero registration, and after the search, we found around 16,000 hits. But the duplicate removal, after the duplicate removal, it's still 13,000. So now we are in the title abstract selection phase with the deadline of end of this December. So let me introduce my second project, which is investigating the oral health status in patients with congenital heart defects. What are congenital heart defects, or CHD? It's when a baby is born with abnormally structured heart and/or larger vessels. It is the most common type of birth defect worldwide, affecting 40,000 births per year only in the US. In other words, we can say in every 15 minutes a baby is born with a heart defect. We also know from a recent study that this condition somehow alters and weakens the natural tooth structure of primary teeth. In these patients, the rate of enamel defects like enamel hypoplasia is also higher. So we know that this condition affects teeth, making them weaker and more prone to caries. So the oral health of these patients must be important somehow. If a patient has caries and poor dental hygiene together, these can lead to severe infections, affecting not only the mouth, but the whole body, and can affect other vital organs, such as the heart. And the heart of these patients are more susceptible for heart infections because of the defects, namely infective endocarditis. Its incidence is 100 times higher in patients with congenital heart defects. So this condition is caused by bacteremia, which can be induced by the patients themselves by brushing their teeth or just chewing. And as dentists, we can also cause bacteremia by different dental procedures. If we work in an environment full of bacteria, caries, periodontitis, or infection, the risk of getting infective endocarditis after our treatment is higher, because these are risk factors for this condition in congenital heart defect patients. So we do not want this to happen, because infective endocarditis is a life-threatening condition, and it's really difficult and expensive to treat. So we would like to prevent it. The first step here is to establish a connection between congenital heart defects and oral health status, which is our aim in this project. The clinical question is there a difference in oral health parameters in patients with congenital heart defects compared to healthy individuals? We would like to investigate the caries prevalence, the periodontal status, and the gingival index. Our hypothesis is that patients with congenital heart defects have worse oral health parameters. The clinical implication of this is that a tight dental control is necessary for these patients and should be included by guideline. And the cardiologist who meets these patients first should send these kids to the dentist so we can have a checkup and treat the conditions. We did the preliminary research and found a previous systematic review, but now we can include new articles and conduct a meta-analysis and investigate other oral parameters than caries prevalence, like periodontal status and so. So here you can see my 3 key articles regarding this topic, all investigating here the caries prevalence, but there are also studies for periodontal disease and other oral health parameters. So let me summarize my 2 projects. The first one is about dental fear and anxiety, and we would like to manage it. And the second project is about the oral health of patients living with congenital heart disease. I would like to end my presentation with the words of Ábel: "A discovery is said to be an accident meeting a prepared mind." So thank you for your attention.
Thank you for presenting these very, very important topics. Have you considered about adding in the first project another arm of using hypnosis for lowering anxiety in dentistry?
At first, we wanted to include, but in the previous year, there's another meta-analysis of this, so we don't want to include now. But hypnosis is also a good and efficient way to manage these patients.
Thank you.
Thank you.
Congratulations for your presentation. I would like to ask regarding to your first project, because I was the kid who have never opened the mouth at the dentist. So I was just wondering that can be effective or useful for the kids as well?
Yes, we would also like to investigate pediatric populations, and it may be strange, but they use midazolam, which is a benzodiazepine for kids who are uncooperative. So yeah, we would like to investigate that and make a subgroup with the kids.
Thank you.
Other questions? No? Okay, Nazanin?
So, if I'm not mistaken, your outcome was anxiety score and the population for the first project. And the population was patients attending the clinic. So, my question is that it can happen that some of the patients had some anxiety background or maybe general anxiety disorder. So, how are you going to manage selecting patients and give them score based on if they have some anxiety background?
Thank you for your question. So, there are articles which describe the general anxiety, and in these patients the dental fear and anxiety is also, its incidence is higher, but unfortunately the studies investigating the interventions are excluding them because it's harder to compare. So we would like to investigate them, but we don't have so much articles for these.
Thank you. It was a great presentation.
Thank you.
Lily?
So first of all, congratulations. And my question is regarding to your first project. What is the difference between the dental fear and the dental anxiety?
Thank you. So it's not an easy question. The fear can be described as something we are afraid of, like it has a subject, like the injection or the needle. But for the anxiety, we don't have a specific subject. But in this study, we can distinguish between them, and the studies also can distinguish between them, so they use the term dental fear and anxiety together. So it's a little bit unfortunate, but that's how we can describe this condition. Or, yeah.
Thank you.
Thank you.
My co-chair also has a question.
Thank you. Actually, it was partly already answered, but regarding the population in both projects. So you only mentioned like patients, not adult patients, but I think there might be some difference. Maybe in the first project you examined adult population, and in the second one only children, or adults as well.
In the second one, we would like to include adults, but based on the previous studies, the difference I showed in the two structure only describes the children because the primary teeth. But as they have worse primary teeth or worse condition in early childhood, this will affect their permanent teeth as well. So we would like to do a subgroup analysis.
Well?
Sorry?
Is it already proved as well?
I don't think so. So there are studies, but we don't know if there's a difference in adults and in children.